Watch down straight away kumlokpa.com. Ma mirolo about tuo nyachnyo makilwoni gonorrhea. Ala Daktari achel makilwoni Dr. Patrick Musinguzi wajeni gonorrhea is not eradicated in Uganda. Gonorrhea futiritual matika yellow dano. Although of course health facilities tika registering a few cases kakany anni. If you remember when we were growing up, tuo makifoni watu tuwal kere P4 science me P4. I still remember up to now gonorrhea ki go chal pala cho mono chunku mana tika light ki waini la cho kati gonorrhea, his genitals are affected and then he feels a lot of pain. Ngoma kitwero timo kumbete anani.
Atamani kangara komelet mero chero yara dog. PM and to mara munyu matika dog when you gonorrhea, syphilis. Those were the most scary diseases makwaini komagwangito. Now, ka macha onene cancer mamako darking organ. I kept on confusing cancer with syphilis. I kept on confusing cancer with gonorrhea again. PMO atika don.
Could we say cancer was there, but we didn't know
we
cancer
didn't know
was there?
Because karamo atika don.
So cancer is only gonorrhea.
No, I think what you keep how I used to imagine it, you know, being a young kid. Eh?
Oh goodness.
No, because when they were in our children watching anyway.
Yes.
Maki go a chat. Those chats we used to read.
Yes.
Noki go, it is very ugly. Not so to me,
photographic interpretation.
Growing up, that is what I thought. Then later on, Maracha or Domatic and Yangi, and I oh, any bene part, cut to one of my cars and Benetia, Benechamo, Kumano. Then that is how my mind started relating. But I mean, what she Genapera cut to Otikanya. Let us go to the hospital.
Challenge, my
the
dear.
war, I watch it down, I watching the sexually transmitted diseases are still there. What would you benefit? And I watch it down, I want let's spread love, not HIV/AIDS. Let's spread love, not STDs. KTK STDs matter treatable. Go and treat. That is simple. Go to the hospital. Neno ngari ngari don come lengful peke tuo. Ngari do join human nyir tiki tuo peke neno ke wang. Cherry or yat nong tam ki bod Daktari ka kumelet we ke treat.
But challenge material kumbete tutual tuo machalo gonorrhea, syphilis kigena and those are sexually transmitted diseases. Mono tuo mangar monono bero la cho bero kidako mapo rugo gene mupiera roach bull makilwoni condom kile mono. Kumbete people are preferring unprotected sex. Magian ben picking him a bed tual. So do we still need to go and teach Pat to use a condom? Really?
Given Makaloni sexual reproductive health rights. Imunya wayo, actually, let's spread love, not HIV/AIDS. Let's spread love, not STDs. If it is my responsibility to protect the one I love, I
want you to be straight. You are speaking like a guy. Tell them to put on a condom. Use what we want to hear.
To protect your loved one, if it is going to be rate ikela cho roach ball. Ke roach ball inyoro ma ikumngat metika bedu kweni. Endo ka in kumulate. Itika poko tuo meni pia bene wat niki mi tuo. Then you are the devil.
Wow. Because ke na my bed to Pat, honestly speaking, Jom ke na ben tiki tuo and they decide not to go to the hospital. So Ian kai tiki tuo charo Dr. Musingu tika waju kere ni tuo gonorrhea futie tuwal among Ugandans wa kiganka kenyo enani and pubiru tuo maki makoba nikolo socially transmitted. It is sexually transmitted. Mono no iberi kingar mo ma pe gwoke